ILCA is a multidisciplinary association, so we aim to appeal to all disciplines involved in the treatment of liver cancer, and those people who attend will get exposure to everything from basic science about liver cancer through to screening, diagnosis, as well as the latest treatments. And I think in terms of the theme, and the basic message is that patients will get better care through multidisciplinary management. So I guess the major advances in the past few years have been in systemic therapy. So for many years we had tyrosine kinase inhibitors, first sorafenib and then lenvatinib. In more recent years we've also had the combination therapy with immunotherapy, and this has really improved response rates and improved survival. Those are now being incorporated into earlier stage disease with local regional therapy as well as surgery, although the data are still quite immature and we need to wait for further follow-up. So I think we've seen probably that in the last 12 months the most interesting studies have been the combination of systemic therapy, immunotherapy with local regional therapy, which have shown encouraging results in terms of progression-free survival, but we need to wait for more mature data with overall survival. There was a lot of interest in adjuvant immunotherapy, and the initial signals look promising, but we've subsequently learnt that those trials have become less encouraging, and so there is still work to be done in terms of developing effective adjuvant therapy. So I think it depends on what type of liver cancer you're talking about. With hepatocellular carcinoma, which is the most common type of cancer, we don't have any actionable mutations or molecular changes to guide therapy. However, in cholangiocarcinoma, there are actionable mutations for which there are approved drugs. So precision oncology is certainly there for cholangiocarcinoma, but not for hepatocellular carcinoma. So I think liver cancer, is one of the most exciting areas of cancer research. There's a huge amount going on. There are great progress happening. So I would encourage young investigators to get involved with research in liver cancer and help us to improve outcomes. So liver cancer remains one of the highest causes of cancer-related mortality globally. It still has one of the worst outcomes for all cancers, so there's a huge amount of work to be done to improve prognosis.